The doctor in question was working as a locum GP at a practice where the patient was registered. He had access to the patient's electronic health records through a secure system that required a username and password. The doctor had no prior relationship with the patient and had never seen him for any consultation. One day, the doctor decided to look up the patient's medical records without any consent or legitimate reason. He was curious about the patient's health condition and wanted to know more details. He searched for the patient's name and date of birth on the system and opened his records. He browsed through the patient's history, diagnoses, medications, test results and referrals. He spent about 15 minutes reading the patient's records. The doctor violated the patient's privacy and breached his duty of confidentiality. He acted against the ethical guidance of the GMC, which states that doctors must respect patients' right to privacy and protect their personal information. The GMC also states that doctors must only access or disclose information if they have a valid reason to do so, such as providing care, protecting patients or others from harm or complying with legal obligations. The doctor had none of these reasons and acted solely out of curiosity. The doctor's actions were discovered by the practice manager, who noticed an unusual activity on the system. The practice manager checked the audit trail and found out that the doctor had accessed the patient's records without any justification. The practice manager reported the incident to the GMC and informed the patient. The patient was shocked and angry when he learned that his privacy had been violated by a doctor he did not know. He felt that his trust in the medical profession had been betrayed. He wanted to know why the doctor did it and what he did with his information. He also wanted to know what actions were taken against the doctor and what measures were in place to prevent such breaches in the future. The GMC investigated the case and found that the doctor had acted dishonestly and unprofessionally. The GMC decided to disclose the details of the investigation to both parties, relying on their legitimate interests in fairness and transparency. The GMC also considered that there was minimal risk to the doctor's reputation and no risk that the patient would misuse his personal data. The GMC concluded that the doctor's conduct was serious enough to impair his fitness to practice. The GMC imposed sanctions on the doctor, including a suspension from practicing for 6 months and a requirement to undergo retraining on confidentiality and ethics. The GMC also issued a warning to the doctor, stating that any further breach of confidentiality would result in more severe consequences. The patient was satisfied with the outcome of the investigation and felt that justice had been done. He hoped that his case would serve as a lesson for other doctors who might be tempted to access patients' records without consent or legitimate reason. He also hoped that his case would raise awareness among patients about their rights to privacy and confidentiality. The doctor in question was treating a patient who had a rare genetic disorder that caused severe pain and disability. The patient had confided in the doctor about his personal and family history, as well as his struggles with depression and suicidal thoughts. The doctor had assured the patient that his information would be kept confidential and only shared with other health professionals involved in his care. However, the doctor violated this trust by disclosing the patient's confidential information to a third party without authorization. The third party was a journalist who was working on a story about the genetic disorder and its impact on people's lives. The doctor had met the journalist at a medical conference and agreed to give him an interview about his research on the disorder. During the interview, the doctor revealed the patient's name, age, occupation, and medical history, as well as details about his family and mental health. The doctor also showed the journalist some photos and videos of the patient that he had taken during his consultations. The journalist used this information to write an article that was published in a national newspaper and online. The article included the patient's full name and picture, as well as quotes from the doctor describing his condition and prognosis. The article also mentioned some of the patient's personal and family issues that he had shared with the doctor. The patient was shocked and devastated when he saw the article. He felt betrayed by the doctor who had violated his privacy and dignity. He also felt exposed and humiliated by the public disclosure of his sensitive information. He experienced an increase in his pain, depression, and anxiety, and had to seek counseling and support from other sources. He also faced harassment and discrimination from some people who read the article and made negative comments about him. The patient decided to file a complaint against the doctor with the General Medical Council, GMC, which is the regulatory body for doctors in the UK. The GMC investigated the complaint and found that the doctor had breached several principles of good medical practice, such as respecting patients' confidentiality, obtaining consent before sharing information, and acting with honesty and integrity. The GMC also found that the doctor had failed to protect the patient's welfare and interests, and had caused him significant harm and distress. The GMC decided to take disciplinary action against the doctor for his serious misconduct. The GMC imposed sanctions on the doctor's registration, such as suspending him from practice for a period of time, restricting his scope of practice, or requiring him to undergo further training or supervision. The GMC also issued a public statement about the case, warning other doctors about the importance of respecting patients' confidentiality and consent. The doctor expressed regret and remorse for his actions, but it was too late to undo the damage he had done to the patient and his reputation. The doctor learned a hard lesson about the consequences of violating patient privacy and breaching professional ethics. The General Medical Council, GMC, is the regulator of doctors in the UK. It has the power to investigate complaints of misconduct against doctors and to take action to protect patients and the public. The GMC can refer cases of serious misconduct to the Medical Practitioners Tribunal Service, MPTS, which is an independent body that conducts hearings and decides on sanctions. In this case, the GMC received a complaint that a doctor had violated patient privacy by accessing confidential medical records without consent and disclosing personal information to a third party. The GMC conducted an investigation and found evidence that the doctor had breached the principles of good medical practice, which is the GMC's core guidance for doctors. The GMC decided that the doctor's fitness to practice was impaired and referred the case to the MPTS for a hearing. The MPTS appointed a tribunal of 3 members, a legally qualified chair, a medical member and a lay member. The tribunal heard evidence from both sides and considered the sanctions guidance, which is a document that helps tribunals to impose sanctions that are fair, proportionate and consistent. The tribunal found that the doctor had committed serious misconduct and that his actions had undermined trust in the profession and brought it into disrepute. The tribunal then decided on what sanction to impose on the doctor's registration. The possible sanctions are no action, advice, warning, conditions, suspension, or erasure. The tribunal has to balance the interests of the public with those of the doctor and take into account any mitigating or aggravating factors. The tribunal also has to explain its reasons for its decision. In this case, the tribunal decided that the most appropriate sanction was suspension for 12 months. The tribunal considered that the doctor had shown remorse, insight and remediation and that he had a good previous record. However, the tribunal also considered that the doctor had breached fundamental duties of confidentiality and honesty and that he had caused harm and distress to his patients. The tribunal concluded that suspension was necessary to maintain public confidence in the profession and to declare and uphold proper standards of conduct. The tribunal's decision was published on the MPTS website and notified to the GMC, the doctor, and any other relevant parties. The GMC has the right to appeal against the tribunal's decision if it considers that it is insufficient to protect the public. The doctor also has the right to appeal against the decision if he considers that it is unjust or disproportionate.